Hi, everybody. My name is Dr. Michael Hirsch, and some of you know I've been the Chief Information Officer for the City of Worcester's pandemic response, and I'm the Medical Director for the Division of Public Health here in the City of Worcester and also in 6 surrounding townships that are in our Central Mass Regional Public Health Alliance. So I'm very excited and very grateful to Amy Waters and the folks at the Senior Center to give me a chance to have a platform like this on the wonderful government channel to chat with you a little bit, at least give you some information that hopefully will be helpful. I hope also it will instill a little bit of an uplifting feeling, because I think we are doing very well as a community. You know that when we first identified the first case of COVID here in Worcester was March 11th. So, you know, we're now officially 5 months later and a little bit of change. And a whirlwind of things have happened in that time. When we first identified the cases, they were coming in big clusters. And by the time we got to end of April and then beginning of May, we were really just flooded with cases. And that's why the city manager and Mayor Petty decided we've got to do daily outreach with press conferences. And I was really privileged to join them as the kind of three-headed monster that was giving the information every day. But now that things have gotten a little bit under control, we haven't been as out there, so this is my opportunity to connect with you all again. So first let me just get back to basics, because I think we've forgotten a lot of this stuff from what we were originally telling people when the outbreak happened. This virus, which everyone calls something different, COVID-19, coronavirus, these little critters, these viruses, are traveling in your nostrils and in your throat when you have them, and coughing and talking and sneezing spread the virus by droplets. This is a virus that is a cousin of the virus that causes the common cold, but unlike the one that causes the common cold, it is really difficult sometimes to shake the medical consequences of this. This is just not headache and a little fever. It can really get to be very, very serious, involving the lungs, the kidneys, the blood clotting system in your body, and subsequently causing heart attacks, strokes, vein thrombosis in your legs that become traveling clots in your bloodstream that go to your lungs. That's called a pulmonary embolus. All of these disease risks are entailed when you get COVID. Now, if you're in the particular age group that frequents the senior center, your risk is really much higher. We have found that probably 35% of the patients that have suffered from the virus by testing have been seniors, but their rates of hospitalization and their rates of needing the ICU and their rates of needing the ventilator, and unfortunately their rates of dying are much higher. So we are really, really invested in trying to keep your age group from contracting this virus. Now, I'm in your age group too. I'm 66. I'm not trying to pretend I'm a youngster, but I know many of you that are listening might be older, and we need to really be, as a community, very protective of your health, but you have to help us too. So what have we learned over the course of this time? So there have been now somewhere in the range of 6,000 cases of COVID-19 here in Worcester itself. Fortunately, we've not had a huge number of deaths in Worcester. There are about 300 deaths in Worcester so far. What I would say is that that's a tribute to the kind of response we've gotten from the community. What am I talking about? I'm talking about when we asked people to shelter in their homes except for emergencies, when we asked them to distance themselves from one another when they were outside, when we asked them to wear a face mask, when we asked them to use hand sanitizers or frequent hand washing, all of these things were done. And I think that's what's kept Worcester so much less troubled by this virus than the ones that we've seen attack other cities around the country. We have just had a terrific response from the community. We also have to take our caps off to the medical community. Dr. Eric Dixon at the UMass Memorial Healthcare System, Dr. Carolyn Jackson at the St. Vincent's Hospital System, banded together to coordinate efforts to care for COVID-positive patients. And the city manager and the mayor worked with them and brainstormed where were our vulnerable populations going to be and what we could do to protect them the most. So what we ended up doing was unclogging the hospital system. We didn't get stuck with many convalescing patients that were just recovering from COVID, stuck in the hospital, taking up bed space from new patients coming in. How did we end up being able to do that? We had a shelter system of 4 and eventually 5 shelters that the city was running to help with homeless people or people that didn't have a situation where they could easily quarantine once they got over the COVID virus. And so that unplugged a lot of beds. And then we had a system where we took over a long-term care facility on Plantation Street with the help of the Salmon Corporation, and the Beaumont Center became a place where we could take elderly patients, and once they were recovering from the COVID virus, we could put them there instead of bringing them back to their long-term care facilities or their skilled nursing facilities, because when that happened, and we saw this in New York, the virus spreads in those populations, in those long-term care facilities like wildfire. And that's where we saw a lot of our deaths. 1/3 of the deaths that we've seen have been in long-term care facilities. So that's coming back to you guys, that you guys are at the highest risk. And we need the rest of the community, obviously, to protect you. But again, those things that we talked about, mask wearing, using hand sanitation, keeping your distance, not going out unnecessarily, and little things. And I bet you these are things that you think of more easily than some of the younger people in Worcester, right? When you go to the store, I bet you if you do go to grocery shop, you have a list. It's amazing how many people that are younger than you don't have a list, right? They're just kind of wandering through the store aimlessly, kind of, oh, that looks nice, that looks nice. That's a perfectly legitimate way to shop before the pandemic. But now you have to have a purpose. You have to identify what you need, get it, and get out. Because anybody that you're in contact with for more than 15 minutes is considered a close contact. And I will get to how important that close contact business is in how we can stop the spread of this virus. But that's what I'm talking about, being mindful of how long you're staying in one place. If you do end up going out with your family to an outdoor seating restaurant, which we currently are allowing in phase 2 of our reopening that Governor Baker has helped us craft, you may notice that people sit and drink and talk because they're so happy to be back together after all these months of being cooped up and isolated way too long. You can't expect a 4-hour dinner with your family and friends to end well if all that time while you're eating and drinking, you don't have your mask and you just are sitting there? You're exposing yourself, even if it's outside. So these are the kind of things that we got to think about as citizens, right? Don't expose yourself, and for the sake of your other citizens, don't expose them by by making sure you wear a mask every time you're outside. So a little bit about how we figure out if one has COVID, right? There are a few kinds of tests that are out there that you should know about, and I'll try to explain a little bit about why we would want you to get a test. The newest one that is the most popular now is one where you go to a testing center, and right now we're lucky in Worcester we have free testing going on right through September 12th, and those sites that are doing that are posted in our www.worcesterma.gov website. So you'll go to one of those centers and someone will give you a swab, like a Q-tip. You'll put it in your nostril and you'll just roll around a little bit, and then they will give you a little tube and you'll pop the Q-tip into that tube and then give it back to the observer, the medical observer. When we first started the testing, we had to have people in what was called PPE. That's personal protective equipment, PPE. And they were all gowned and masked, and they had eye protection. And it burned through a lot of PPE that way. This way, we don't have to do it. And you can do it right through your car window in many of the places that are the pop-up testing centers. They're drive-through. There's also a test where instead of that kind of collection, you actually spit some saliva into a cup and then put the cap on the cup and hand the cup out to the medical observer, and that's how the test is done. Both tests seem to be working just fine. And then there's a third test where you actually get a blood test. The blood test looks for special entities called antibodies, where we measure whether or not your body has been exposed to the coronavirus. Because many people get exposed to the virus and never know it. They're totally asymptomatic or without any complaints. So what are the symptoms if you do have COVID? So the most common one is fever, an unexplained fever. And it's usually not super high grade fever. It's like 104 to 100.4 to 101. That's in the range. That's the most common symptom. Second most is a cough. It's a dry, non-productive cough. So many of you have had coughs in your life, and you're not bringing up phlegm with the COVID cough. This is just a constant kind of itching in your throat and you cough. The third most common sign of COVID is having shortness of breath, because it does affect the lungs most commonly. So the feeling like you just can't get a deep breath, right? And then there's some other ones that are kind of interesting and have become more common as we've seen many, many more cases now. There's been, unfortunately, while I'm filming this, there's 170,000 deaths and 5 million cases. There's many, many presentations that have been seen. But one of the ones that's fairly common is the loss of taste or smell. And it's something you might not even complain about or know. You're eating something, it doesn't taste particularly good, and you don't think about it until like the next day you realize, oh, now this doesn't taste good too, and I know this was supposed to be something good. So that is another common symptom. And then there's some really weird ones, like there's an entity called COVID toes, where if you start having pain in your little toes, and you look down there and you see that they're black and blue, but you haven't been like exposed in a frostbite situation, or you haven't burned yourself or anything like that, that's one of the things that COVID virus does. It causes blood clots in little vessels, and that can cause those kind of symptoms. So if you have any of those symptoms, we would really urge you to contact your doctor immediately. And that doctor, depending on how sick you are, is going to ask you to get a test. And that's the testing that we just described. More and more, it's available in drugstores, and it's available now free in many places around the city. If you have those symptoms, you have to wait till your test is negative before you stop quarantining. So what does quarantining exactly mean? If you're living by yourself, quarantining is tough because it means you can't go out of the house. That means you have to have some mechanism of getting food to you. Food delivered, shopping delivered. There are great systems now in place, though. And for the elderly, there have been Meals on Wheels and extensions of that program to help us accommodate all the seniors that needed those kind of meals. And then many of the big supermarkets have developed this home delivery service, and that has made it a lot easier. So although it's tough being by yourself quarantined, it's sometimes tougher if you're in a house with a lot of people in it, because then you have to make sure you find an isolated area in your home that you can stay in a room and sleep and get your food sent up to your room. Somebody from your family makes you some lunch, makes you some breakfast, makes you some dinner, knocks on the door, moves away, you open the door, pull in the tray, and do your eating. Then when you're done, you leave the tray outside, but you put all the garbage in a bag that you double bag so that your relatives don't have to touch anything that has COVID on it. And there are a lot of instructions about this also on our www.worcesterma.gov site. So quarantining is a real mainstay of how we can contain the virus. The other thing is, if you have had a positive test for the virus, you're going to get contacted by our tracing team, our contact tracing team. And what does that mean? Someone will get the information that you have a positive test. It will go into a database that comes out at the Worcester Department of Public Health on Mead Street. Once we identify your name, we will call whatever number you have given on your slip that when you got your test, and we will verify your address, and we will verify that you can be called at the number that we used. Then you're going to find that the contact tracers are going to call you, and what they're going to say is, can I have a description of where you were the 48 hours before you tested positive? And you're going to have to try to remember as best you can. Did you see your best friend? Did your nephew or niece come over? Did your son come over? Were you playing cards with your friends? These are the people that will then get contacted because they are contacts of you. And by doing this, we identify all the people that we think need to be tested. They come in and get their test, and it goes on and on and on. If one of your friends tests positive because they were in close contact with you, they will in turn generate a list of contacts that we will trace. It's a very difficult process. We have been so blessed in Worcester. We've had retired nurses, retired doctors, medical students, nursing students, Worcester Medical Reserve Corps people helping us do this contact tracing. The governor has also provided us with contact tracing folk, And between all of it, I think we've kept on top of it. And you may remember over the summer when we realized that there were a lot of cases brewing at Walmart, we had to, unfortunately, because we were doing so much tracing, we had to shut the Walmart down. So this is a very dynamic process. It takes a lot of manpower, takes a lot of man hours, but we do it because we want to keep the city safe. And that's really where, again, we've been so lucky that the community has not been really outrageously flaunting whatever freedoms they think there is by not wearing a mask and by not distancing and by having crazy house parties. We really want to emphasize that that is unfair. If you make that individual decision for yourself, that's one thing, but you're exposing the entire community to a big outbreak if you don't follow up on those things that I mentioned. So this is a show that's going to be kind of like a dynamic exchange in that we're going to do several segments over the next several months, and I don't want to tell everything there is to tell today, but the last thing I want to say is something that Eric Dixon, the CEO of UMass Medical, has been emphasizing all through this. What we have been seeing, and particularly in the elderly, is that people are very afraid to go to the hospital right now. They're worried about catching COVID. They're worried about their exposure when they go. I completely understand why, but that was really based on the fears of April, May, and June. Now COVID is very, very much under control. It's not gone, but it's under control. There's only about 20 patients in the system right now in both hospitals. We had something like 220 back in the height of this when we peaked somewhere second, third week of May. So I would urge you, don't hide other medical problems that you think you're having. If you're having pain in your chest, if you're having lapses of memory, if you're having pain in your legs, if you're having difficulties with your walking, these are all things that are going to be made much worse if you put off seeing the doctor for regular health issues. And if you haven't seen your doctor for a regular checkup, you really should re-engage now. It's time. Now, some of the docs have switched over to being able to do these kind of checkups over the phone or over the TV or over your computer if you use that. But it doesn't have to be like that. Some folk like the idea of not having to go into the hospital and doing something over the phone, and some people just love the connectivity of being with the doctor. Personally, I love seeing my patients in person, but I'll do whatever the patient feels most comfortable with to make sure that they're maintaining their health at the same time as they're avoiding the COVID thing. So don't hide symptoms. Address them. Make sure you're taking care of yourself. Last thing, the schools are going to be partially reopening. Not the Worcester public schools. They're going to take a little break until maybe end of October. But the higher institutes of learning, of which we have 11 here in the metropolitan area of Worcester, are coming back into town. And that brings about 25 to 30,000 young people to add to our population, to increase our economy, but also increase our risk of COVID. So September, when you're listening to this, might be a time when you have to be a little careful about when you shop and where you shop, because if it's frequented by college kids, they are sometimes more likely to be a little loose with their compliance about separating and wearing masks and doing all the hand sanitation. I know the colleges have been working hard with the Worcester Department of Public Health to come up with plans to make sure that their students are safe, And we're emphasizing when we talk to the students that they have to keep you safe in the senior center. So it works both ways. But I don't want you guys to be caught unaware. If this big flood of college kids come in and you start hearing that we are going from a rating of yellow, which we currently are, to red, that's not the time to be out and about. That's the time we've got to hunker back down and keep you guys safe. So that's where I'm going to stop today. I am so pleased and proud that I was given a chance to talk to you like this. I hope we can get you more information as time goes on. And thanks again for listening. We'll see you next time.